Hi everyone, in this video I'll give you a brief overview of scarlet fever. So some background information. It is an exotoxin mediated disease caused by group A beta-haemolytic streptococci. There's an incidence of roughly 1 in 14,000 and the condition affects mainly kids ages 5 to 15. There's up to 4,000 cases a year recorded in the UK. And the condition is more common in winter and spring months. In terms of the clinical presentation, there's an incubation period of roughly 2 to 4 days, and then you have a prodrome of sore throat, headache, vomiting, abdominal pain, amongst others. Next, you have scarletiniform rash, which is sandpaper-like in texture, which is one of the key words, and it tends to start on the neck and scapular region and then goes down to the trunk. However, interestingly, the area around the mouth is usually quite pale compared to the flushed face of the child. And here you can also see a diagram of the scarletiniform rash. In terms of the throat, you would have something called a strawberry tongue, where you have white fur covering the tongue and some red papillae. In terms of the investigations, the diagnosis is usually made clinically, and that is often enough. However, you can do a throat swab, which can detect the group A beta-haemolytic strep antigens. And if you do a full blood count, you would see polymorphonuclear lymphocytosis. In terms of management, you would give antibiotics, namely penicillin, or if the child is allergic to penicillin, you would give erythromycin or azithromycin. You would also want to give rest and fluids, and you can do symptomatic management with things like ibuprofen or paracetamol. Most importantly, however, is that the child remains infectious for 24 hours after the first antibiotic dose, and therefore the child should not be going to school for at least 24 hours after the first dose has been given. In terms of complications, the main ones include cellulitis, meningitis, rheumatic fever, and post-streptococcal glomerulonephritis. However, in terms of the prognosis, it is generally good, and there's been an improvement in prognosis largely due to the use of penicillin for the treatment of this condition. This was a very quick overview. If you have any questions, leave them down in the comments. But other than that, thank you so much for watching.